When elevating a patient in the device with a lift, the patient should end up in a recumbent position. This is enabled by connecting the outer loops of the 4 middle handles first, and then adjusting the loops for tail and top handles individually. When possible, it might be helpful to place the Z-Flow positioner between the patient's knees to prevent the hip from internal rotation. This will add extra comfort. Let the patient's arms rest on the chest or abdomen to increase comfort during elevation with a lift. Attach the 4 middle handles on each side of the pad evenly to the hanger bar. It is recommended to use the outer loop on the handles. Unfold the tail until it reaches the back of the knee. If needed, assist the patient in bending their knees before attaching the knee straps. Taller patients might need the tail to be fully unfolded and, in certain cases, supported by an extra caregiver. Proceed by attaching the tail and top handles to the hanger bar. If needed, adjust the length of the handles by using the loops to create tension to the straps. To improve comfort, make sure to prevent the black non-skid surface from coming in direct contact with skin. Perform a safety lift. Initiate the lift and stop when there is tension in the handles and ensure that all loops are secured. Lift the patient carefully. It is recommended that one caregiver holds the patient's feet during the lift for additional security. For transfer upwards and bed boosting, simply move the lifted patient upwards and align the sacrum line on the back of the pad with the hinge joint of the bed. Tuck the tail and the black flaps. Set the bed in a comfortable position. For transfer to another receiving surface, prepare by adjusting the inclination of the seat and the backrest to the same angle as the bed. When transferring the patient to a cardiac chair or recliner, it is important that the receiving surface is tilted a bit backwards, especially the seat. Make sure that both supporting surfaces have locked wheels. Lower the patient towards the chosen receiving surface. Use the sacrum line on the back of the pad as a reference for easy alignment of the patient with the surface. Gently place the patient comfortably on the receiving surface. When transferring the patient to a cardiac chair or recliner, it is important to provide a safe position. If applicable, remove the Z-Flow positioner from between the patient's knees. Smooth out the sheet to ensure no wrinkles are present under the patient. Tuck the tail and the black flaps on both sides of the pad to create envelopment effect. Make sure no straps are stuck to the chair or placed under the patient to avoid pressure points. If foot support is available, its use is strongly advised to prevent the patient buttocks from sliding when the patient is seated in a chair. If applicable, confirm that the patient's sacrum is aligned with the lateral sacrum line of the pad in the hinge joint on the receiving surface. For transferring the patient back to the bed, repeat the steps above.